Hi, I'm Dr. Christopher Gopp at Dentart Chicago, and I'm here to answer a couple of questions. So dental fillings are a replacement for decayed or broken tooth structure. We clean out the tooth, we open it up, and then we fill it in, so we replace that missing structure. Fillings absolutely can be avoided. We're trying to avoid any tooth decay in general. One of the biggest things is sugary diet or not having good oral hygiene. Trying to avoid as much sugar and brushing your teeth twice a day and flossing, all of these things help prevent cavities in the first place. Dentists can do fillings without having to do any drilling, but it really depends on the filling specifically. More often than not, it is required to remove some of that decayed tooth structure. The old school stuff is the amalgam or the silver fillings that you see, and those are fantastic, but they're not as commonplace anymore. And now we often use resin composite fillings. It's a light cured, polymerized filling material that's white and it's tooth colored. Yes, it can. We have multiple colors of this composite material, so we can make it look as natural as possible. There is an uncomfortable moment at the beginning when we get you numb, but once the tooth is numbed up, you shouldn't feel anything other than a little bit of pressure. The nice thing about these resin composites is as soon as we are done curing them, you are ready to go. You can brush your teeth, you can eat. The only thing we ask is that you wait until you can feel your lip or your cheek again, because you will be numb and we don't want you to accidentally bite yourself. Sometimes dental fillings do need to be replaced. Between the tooth and the filling, there's a space where we put bond so that it actually holds in place. Sometimes over years that bond breaks down or fillings break and there can be cavities around or underneath that filling. So that at that point, yes, they would need to get replaced. If you think you might need a filling, if you're feeling any sensitivity, if you see something, schedule an appointment for as soon as possible. Otherwise, we like to see patients come in every 6 months just for regular checkups, just to catch things before they're too deep. It's much better to get things done before they're a bigger problem.